Hi, I'm Jonathan Colopy, an executive with the YMCA of San Diego County, and this is the Wise Be Well podcast. Thank you for joining us. Today we have Debbie Day with us, board chair for the American Heart Association. Debbie, thank you for being with us.
Happy to do it. Thank you. Nice to see you, Jonathan.
Nice to see you as well. So I understand that February is Healthy Heart Month. And so with that, I know American Heart Association has a particular focus each year. What might the focus be this year?
Well, February is Heart Month. Last year, we celebrated our 100th anniversary at the American Heart Association. And this year, our theme is Your Child, Your Heart, shining a special light on encouraging people to understand how they can help infants and children, which you wouldn't normally think of as being suffering from any cardiac event, but this actually does happen. So that's our theme, Your Child, Your Heart.
Wow, that's all of us in community recognize all the children and how critical it is. As I understand, CPR is an incredible resource when we talk about our heart. Here at the YMCA, our lifeguards, as well as every staff member of the Y, is trained in CPR. And when I came to the Y for the first time, I just thought that was amazing that I was going to be equipped with this resource, because even in the facility here at the branch, as well as out in the community, I feel empowered that I could provide support to help save a life. So share with me the particular focus, as you say, Your Child, Your Heart. What is the American Heart Association doing with that theme? How is that being enacted?
Yeah, well, first of all, I applaud the Y for doing everything you just said. I think when I got involved with the American Heart Association a few years ago, I did not appreciate what CPR could really do. I learned it a long time ago as a Girl Scout. And at that time, it was very different than hands-on only CPR. And so the first thing I'll say is hands-on CPR can double or triple the chance of survival. That's very important.
That's
and so
profound.
Even if you're in a restaurant and somebody has an event, if you know what to do, the steps in calling 911, which is absolutely critical, while you're giving that hands-on CPR, you can save a life, just as you just said.
Yeah.
The difference with infants and children is the CPR also needs the breathing that we learned when we first learned CPR many years ago. So the other thing I would say, I'd just like to share some statistics because I found this very surprising, is 23,000 children experience cardiac events outside of the hospital. 40% of those are related to sports. And I've now met many mothers or fathers of children who have had a cardiac event, like on a football field, whatever. But nearly 20% of those numbers are infants. And you wouldn't expect that.
That's a significant incident, so to speak, in the community. When you say hands only, so I was really struck by hands only alone has such a tremendous impact. And as I understand that in practice, it's the thrusts on the chest at a particular rhythm. And then, as you said, as you add in, or actually, as I understand, you start with the breath, ideally, and that helps promote that breath being moved throughout the body. But alone, just hands-on, knowing how to do that can have a significant impact.
Yes, and I think it takes a lot of the fear, maybe, of doing it. And so the impact is more than you would expect. I encourage everyone to get trained. And you can go onto the American Heart Association website and see videos and exactly how to do it. But the beat is to that song from Saturday Night Fever, Staying Alive. So as long as you can keep up with Staying Alive, that's the right pace, and anybody can do it. And once you do this, we just said double or triple the chance of survival. The other thing I'd share, Jonathan, is that there's a difference in this, especially as it relates to women. So I would like to profile that. The fact is that society is more inclined to give men CPR than women for a variety of reasons.
Oh,
And that's a piece of awareness that I would like to raise, because it is just as important for women to receive CPR.
so Debbie,
Exactly the same.
help me understand that. That's fascinating. Meaning, if a woman is in distress, possibly cardiac arrest, they are not as likely as a male to be able to get CPR intervention.
That's exactly right. And the reason is society fears the breast region. And so that alone is part of the reason that women don't get the care. I think the other thing is the fact is female research in cardiac activity has been under-researched, underfunded. And so people have an idea that grown men have heart attacks. But, it's that women may not be having heart attacks at the same rate. And now, as we've just discussed, we're talking about infants and children as well.
That's an interesting, sounds like misnomer, because I believe I had read something recently about the incidence of cardiovascular disease or cardiac arrest for women, and in just the incidence being so great that it may lead to early death. Do you have any insights along those lines?
Yeah, well, I'll say that cardiovascular disease is the #1 killer of women.
Wow.
People don't realize this. And the other thing is the risk factors of blood pressure and all the things that you would expect. Obesity,
probably things like diabetes or high cholesterol
diabetes,
that comes into play.
high cholesterol.
So lifestyle.
That's right. All these are that you just named, 2 of the 4, and then the other 4. These risk factors are present in everyone. And knowing your numbers, as we say in the American Heart Association, which is what is your blood pressure, what is your cholesterol, just the awareness of knowing your risk factors, what you can do.
We probably won't get into today, but I'm also aware that probably genetic background comes to play, hereditary. So having that information also empowers you. If you know there's that risk there, then as you spoke to, kind of a healthy lifestyle would be really beneficial. And I think the American Heart Association has a particular initiative or focus as you speak to this area.
Yes, it's called Go Red for Women.
Great.
And I'm a big supporter of Go Red. We're the people that wear red. We're trying to make women aware. It's one thing if you know that genetically you may be at risk, but it's almost scarier if you don't.
Exactly.
And the survivors around women and bringing the awareness to the female community is such an important piece. Women are running around being mothers. This is why we're employing this with the children and teens. Also, they need to take care of themselves as well.
How might you, as an organization, be doing outreach or connecting women in support of, as you said, Go Red?
I'd like to give a few examples of what the American Heart Association does. First of all, the AHA works with clinics themselves, and that is administering blood pressure, diabetes, and cholesterol tests. I just found this one out, that we have begun giving libraries blood pressure monitors so people can check them out and be able to monitor themselves at home in case they can't get to a clinic.
That's amazing. I just think of making so access isn't a barrier. I mean, bringing it to the community. Tremendous.
Exactly. And here in San Diego, the Grossmont Healthcare District Library and the Mission Valley Library are 2 that we've begun with. We've got a Kids Heart Challenge program, which is about physical activity, brain health, and mental well-being. We're at the policy level. We're trying to combat the tobacco and vaping crisis, so it doesn't enter our children.
You have a broad mandate in terms of outreach. So
yes,
anything you can tell me about the Children's Heart Challenge, because the Y is the largest provider in terms of that childcare space. And so that's an important thing for us to be aware of and to look at how we can partner further.
Perfect. And the Y is the perfect partner. Why? Because it's looking at all pieces of children, which is the physical activity, the brain health, and the mental well-being. And our kids are stressed, as we all know. So not only do we do a lot of education and integration into schools, et cetera, working with people like the Y, but we also, the challenge is about having them get involved and even do things like the Heart Walk or fundraise so they can give back to the community in a very, positive and life-affirming way.
That's fantastic. So how would I learn about the resources of our local American Heart Association? I would assume there's a landing page, website of resources, especially as you're embedded throughout our community.
Right. So the main AHA website is www.heart.org. Very straightforward. However, to come full circle into what we started with is how you can get better educated. You can go to heart.org/nation, NATION. And in there, I was just on that website, you can put in your location, what kind of class you'd like to take, what kind of certification you might want to pursue. You can even put in your children's age, and it will tell you how you can better support your child should a cardiac event occur.
That's really wonderful to hear in terms of the breadth of services, not only locally, but beyond. I also wonder how we can support. So it sounds like going there and finding out resources. I know here at my particular branch of the Y, we provide CPR classes out in the community. So to empower people to have that resource of knowing how to do infant, toddler, adult CPR effectively. And so, as you said,
That's
to
fabulous.
destigmatize or desensitize the whole idea of, contacting, having someone's hands on one's body, really for the efforts to save a life.
That's exactly right.
Yeah. Now, is our association involved in any kind of policy work to move forward education, awareness, research?
Yeah, the policy work is on many things. And I would say, obviously, cardiovascular health, a lot of research. Another one that we haven't talked about is nutrition security, which is also a big need in the communities. And the thing that I would profile there is the American Heart Association just partnered with the San Diego Food Bank. And we donated refrigeration, because healthy food, many times, especially fresh food, needs to be in a refrigerator. And you wouldn't even consider that as a necessary resource and an extension of the food bank.
But there's a couple of things I like about what you just said there, Debbie. Just the idea of nonprofits coming together to do more together. In my community here, we recognize the food insecurity that there is, and we've partnered with another organization, Feeding San Diego, to distribute food at our branch. Group. And the response has been tremendous. You wouldn't think that the need was there, but we're aware of it. And to see people get the support in terms of, fruits, fresh fruits, vegetables, is really wonderful to see that need is being better met at this time.
I love that you're doing Feeding San Diego, and there's so much need, and I agree with you.
Yeah.
Sometimes you think in San Diego there isn't, but there's a lot, especially children, are being faced with this.
So Debbie, I'm gonna gently challenge you, so to speak. So this program is about being well, living well, and I think about your theme of healthy heart, and I wonder what might be part of your well-being practice to have a healthy heart, especially as you noted, being a woman and the challenges that may be there.
Thank you, Jonathan, for asking me this. I meditate every day.
Oh.
That is a thing for me. I work. I don't work for the American Heart Association, as we discussed earlier. I work as a corporate executive, and we all have stress. wherever it is, whether it's work or home or finances or there's so much to take care of with yourself. For me, meditation has been a godsend in bringing balance and peace into my life.
That is beautiful. I'm a practitioner of mindfulness as well, and
Good.
so I align with what you've shared there. And even though you've said a couple of times you don't work for the American Heart Association, you sure offer a lot of
I
talent
do.
and effort.
I do. I try to give my time.
Yeah. No, it sounds
It's
like
such
you
a
do.
great. It is a fabulous organization, and you know, with everything that is happening, you know, with funding research, we need to support groups like the American Heart Association.
Thank you.
Who are trying to fund.
That sounds like a call to action. Anything else you'd like to just say in closing?
I would just like to say thank you for inviting us. February is Heart Month, and you know, as I received the proclamation from the city of San Diego last week, I ended with join the American Heart Association's Nation of Lifesavers by learning CPR to transition from bystander to lifesaver.
Wow. Well, you've ignited that in all of us listening to you today. So I appreciate it. Debbie, such a pleasure to have this time with you. And thank you for what you do with the American Heart Association.
Thank you, Jonathan. It was a pleasure meeting you.
Thank you. And to all our guests, thanks for joining us. And until our next time we're together, please be well.